Hi, this is Justin in partnership with Rolling Out Health IQ, and we're here to talk about your heart. I'm here with Charles T. Folsom Jr. Charles, it's great to have you here. How are you doing today?
I'm doing great. Thank you so much, Justin, for having me.
Hey, look, it's a pleasure, brother. It's a pleasure. Question for you. So before we get into what, the issues of heart health in African Americans, could you give the community a little bit more about what you do for a living?
I'm a registered nurse of 37 years. I work at Emory Healthcare in the emergency department, and we're a stroke and we're not a trauma center, but we're a stroke center and a heart center in the metropolitan Atlanta area. And we see approximately 200 patients a day.
And then for your product.
Okay. So our product is called eLife Health Summary, and it allows patients to be able to have all of their information on their phone, whether it's an Apple device or Android device, as well as wearables. Like you'll see the wristband that I have. We have cards, we have magnets, and we partner with assisted living facilities to provide services for their patients. But it's basically a pre-hospital care so that all your medications, allergies, and any other previous hospitalizations and all your medical information is available at the time of care.
You are in a unique position, Charles. Have been in the ER. You've been on the medical side. You've dealt with people who are on the table. And then you've also recognized an opportunity to use technology as a pull through to destigmatize healthcare and a group of individuals, a race that's been traumatized
Yes.
by past horrors done in order for the advancement of science.
Yeah.
What is the stigma? Like, what is it? I mean, because at the end of the day, people are more passionate about getting that new iPhone than getting the latest technology that's going to help save their life. What is it with African Americans, and where do you see there being any promise or any hope for us changing and taking advantage of artificial intelligence to improve our outcomes?
Well, we've got to get out of the consuming uh, perspective, and we've got to get back to the engineering perspective. And that's what we see a lot in the schools now, especially the STEM schools and some of the charter schools. But our public schools, we've got some of the brightest minds in the country. They just have to be exposed to the product. So quickly, we're partnering with uh, Fort Valley State University to be able to have their team. It's called FAB. They collaborated with MIT to develop apps and different technologies in HBCUs. And I'm going to tell you, the kids that they have at Fort Valley State are absolutely mind-blowing smart. So we know we have the ability to do the work. It's just a matter of being exposed to it and looking at the engineering part of a product versus just being entertained. And part of that's the social media and other things that kind of, get into our lives and make us, kind of get distracted. But we're so focusing on being entertained and laughing and joking that we don't look at, man, this is a cool product. I wonder how I could make it myself.
Do you think there's an opportunity to make wellness cool again? It seems to be an opportunity not only for the current millennial generation, but it seems like almost like Facebook, right? Like Facebook is kind of old for millennials now, but more boomers are on it now than ever. Thinking
Yeah,
of that pipeline, right? Thinking about how that adoption phase
yeah.
it goes. Do you think there's an opportunity to hit both groups within the community to make wellness and heart health cool again? And if so, where do you think folks should start?
Oh, absolutely. There's a gigantic opportunity there to be able to do to make wellness healthy. I mean, wellness popular, which we're doing now. I've done a few lectures recently. Did one at House of Hope, and I did one with Georgia Hymns Association a couple of weeks ago, and we were talking about the need for better understanding cardiovascular health and the things that kind of put us in bad situations with it. And we talk about this triad of diseases, diabetes, hypertension, and kidney disease, all kind of being correlated. But heart disease is also one of the major factors. And it's very simple terms that you can use to be able to make people understand that there are real consequences to your actions when it comes to your heart health. For instance, I spoke the other day and I told the lady, I said, listen, when your blood sugar is elevated, your body does not make nitrous oxide. Nitrous oxide makes your vessels dilate and relax. So basically, your heart is tense all the time. And if your sugar's up, your blood pressure's up. Your blood viscosity changes. So just real simple practical terms so people can understand that these diseases are not just terms, they have real physical effects on your body.
What are some of the misconceptions about heart health in the African American community, and how do you think technology isn't, or can play a role in changing those misconceptions?
The technology, for instance, Dexcom. Dexcom is one of the most popular items on the market right now. And people put their Dexcom on and it gives them a constant reading of their blood sugar every 5 minutes or even more frequently, but it gives you a constant reading of your blood glucose level. That would be the perfect start for those patients in the African American community who are diabetic. And we make up a vast majority of diabetics in the United States. So if we just start with getting our sugars under control and understanding that processed foods and things like that are really detrimental to our bodies, it's basically your body fighting against the diet that you eat. And it causes tons of inflammation and other symptoms that you see. That would be one of the first markers. Get your blood glucose under control and monitor your blood pressure.
What are some of and to that point, the blood pressure wearables, right? What are some practical steps to someone who knows that heart health is really important? They may have some pre-indicators from either a relative or they've gone to the doctor, and they want to use technology to improve their heart health. What are some basic steps, along with things that may not necessarily use technology, that you would suggest, kind of balancing that nurse technologist outlook? What would
Yeah.
you say to that person?
So anytime when patients buy wearables, I sit down with them and I tell them, hey, listen, what is the real objective of you getting this wearable? It's for you to know a certain number. And then what are your actions going to be when you receive that number? Do you understand? We call them KPIs or metrics, but do you understand what that number means to you as an individual? And then do you develop a strategy to improve that number? And do you know what those numbers mean in real context? For instance, your low density lipoproteins. That's your horrible cholesterol. And if you eat a lot of saturated fat and your blood sugar is out of control, those are the major contributors to you developing plaques in your heart, giving you a heart attack, having to get stents and all that type of thing. But then, a lot of times in our community, we say, well, if we had had a heart attack, we think our heart is healthy. That is absolutely the most untrue thing in the world. More people get congestive heart failure than have heart attacks. And that comes from high blood pressure over long periods of time. So giving them the basic understanding of what the physiology is, and then when they introduce the product, do they know what they're looking for as an outcome from that wearable device or that technology that they're integrating into their lives?
When we start thinking about data,
Mhm.
and everyone get there's a data breach,
Yeah,
right? And then of course we're thinking about matters of the heart.
yeah.
What would you say to the community as it relates to heart health and being more open to technology as a way to save their life? In fact, if you have any examples or anything,
Yeah.
not to put any PI information out there, but I just don't think
Yeah, yeah,
people understand how important technology is right now. And I think it's just something that's in their phone affecting everyone, where as African Americans, we have a huge ground to make up, but it looks like a great opportunity.
yeah, yeah, yeah. So one of the things that I think is a big help for us is using, like, for instance, not to advertise for them, but Apple Watch is really, really useful. It can give you, they got a couple of apps on there that can give you your trended heart rate. And that's one of the things that I talk to people about. Your heart rate should really not be all over the place. That's one of the reasons why you exercise, to kind of get your heart rate up. That way, when you rest, your heart rate's lower and your heart works more efficiently, right? The Apple Watch gives you that information, and they got some applications on there that can kind of tell you, hey, you're really tired or you're not resting good, because we're looking at variations in your heart rate, or even if you're getting your blood pressure, is your blood pressure all over the place, and you got to figure out why. And one of the things, the main issue in your body that controls your blood pressure is your kidneys. So these are the types of things that technology that should prompt you to look and go, well, hey, if my blood pressure is all over the place, do I need to get my kidneys checked, or at least get some lab work like creatinine or a or BUN to look and see what my numbers are, to see if I'm actually filtering the blood that I have, or is my kidneys giving me problems that's causing my blood pressure to be out of whack.
When you, as an African American male,
Mhm.
we don't always go to the doctor. right? And that high blood pressure is a silent heart killer, silent killer. What would you say to African American males as a nurse practitioner, as a nurse, and
Mhm.
as a entrepreneur that's here to heal the community? What message would you give to them and to women supporting African American men in order to save a heart?
You got to follow up with your PCP. You got to be involved with your if you need a cardiologist, you need to get a cardiologist. Anybody over 40 something years old should get a baseline EKG. If you're over 50, you should be getting EKGs every year in my book. Just to see if you're having any issues, or the EKG will be able to show if you've had any interruptions in your electrical conductivity of your heart. Heart healthy diet, you need to understand the mechanisms of uh, the diet. But the biggest thing is to understand how those plaques form. And that's one of the things that people do not understand. For instance, I worked in a cath lab one time, and I remember the doctor showing me a heart. And I was like, what are those little plastic straw looking type things in that heart? That looks crazy. And they were yellow and yucky looking. He goes, oh, that's margarine. And then I researched, and margarine's like one molecule away from being plastic.
That's crazy. Margarine, who would have thought,
And
right?
we eat it because it's cheap. We eat it because it's in our neighborhood. We don't have all of the organic stuff. We got a lot of stuff that's genetically modified, and the sweets and the things are just, it's pushed on America as a society. But in our neighborhoods, that's the thing at the first part of the counter. You
Right.
can't check out without seeing Little Debbie's and Snickers bars and Reese cups, because they want you to buy all of that stuff. And it's become a epidemic in the African American community, because you got to look at, we have a large portion of the things that go on with us from epigenetics. So epigenetics is really the baseline of who we are as people, the residual of all those thousands of millions of Africans who were brought to the United States. All of that trauma and all of those things that they ate has been passed on in our DNA. So that's one of the reasons why we get the diagnosis of primary hypertension so frequently.
So
It's genetic.
epigenetics, so epigenetics is real, and and again, because
Oh yes, epigenetics is very real.
there's a mixture of research out there
Mhm.
that suggests that, oh, it's just access. That's why African Americans suffer disproportionately because of access to care. Like their heart suffers more because they don't have the right access to quality care. But what you're saying is that epigenetics is also another factor into that. Could you explain that more?
It's a huge factor. I had a 29-year-old female that came in. She was maybe 5'6", weighed 135 pounds, non-smoker, no alcohol, vegan, had a stroke. And her blood pressure was 220 over 150. And didn't realize she had a stroke. She just felt a little funny.
So she was well within her BMI and everything. It's just something that's within her genetics.
In perfect health,
Wow.
and had a stroke. So we know it's not, she exercised. She doesn't smoke. She doesn't drink. No drug use. And when they bring her in, they'll say, hypertension, etiology unknown, which means they don't know the cause of it, but it's primary hypertension, and it's coming from somewhere. And I guarantee you, when I talked to her and we look back, her mama had it, her grandmother had it, her great great grandmother had it.
And so having these conversations as a
Having these real
family,
conversations,
yeah, is going to be really helpful.
it will
Charles,
be.
really appreciate your time, brother. Thank you so much for the insights, for the stewardship, for the healing of the community. I really appreciate your time. Thank you again.
Thank you.